Hey everyone, this is Kristen, and today I want to talk about a topic that's become something I'm really passionate about, which is muscle weakness in Ehlers Danlos patients. And the reason that I've become so passionate about this is for the past few years, I've been experiencing episodic muscle weakness, which a lot of times is accompanied by other symptoms. And so I've been trying to figure that out for quite a while now. And in the process, I learned about periodic paralysis, I learned about functional neurological disorder, as well as a bunch of other conditions that can cause muscle weakness. I want to raise awareness about those conditions in case you find yourself trying to find an explanation for your own situation. It is also Functional Neurological Awareness Month, and so I want to specifically raise awareness about that. Many people also don't know about periodic paralysis, and researchers are actually finding out that a lot of Ehlers-Danlos patients actually have periodic paralysis. And there's an open question as to whether there may be a connection between joint hypermobility and periodic paralysis. So I'm going to jump right in. I've got a lot of notes today, so I'm going to be going back and forth. I'm going to include a lot of resources in the description. So if you want to learn more about these topics, then check out that below. So how I learned about periodic paralysis is, I'll have to backtrack a little bit. In my diagnosis story, I talked about how I was having, like in 2017, I was having these episodes where I would go into the grocery store and I would experience weakness on one side of the body. I would have difficulty walking. I might have like sensory symptoms where like I became sensitive to motion. But it was pretty scary. It kind of like I was concerned I might be having a stroke. I was checked out for a stroke in the ER one time when I was having difficulty speaking. Which was, it was an interesting experience. But I have a lot of kind of like symptoms that seem to come with my attacks of muscle weakness. The specific areas where I experience muscle weakness are my eyelids, so I get ptosis a lot. That's usually one of the first symptoms that I'll notice. I'll also experience where my throat muscles become more weak than usual. So I'll have even more difficulty swallowing. I'll be choking a lot, like if I'm trying to eat something or to swallow fluids. If I'm chewing food, I'll notice that I'll have like weakness in my jaw or even in my tongue. I get neck weakness, so I get kind of like a bobblehead, or I'll like be bowing my head down like this, or like resting it backwards just because like my neck becomes really weak. I'll get weakness in my arms. Sometimes it'll be difficult to reach above, like if I'm brushing my hair, my arms will get fatigued much more quickly than usual. I get a lot of muscle weakness in my legs, and I think maybe like in my hip muscles. I can't remember what those are called off the top of my head, but I think that kind of like causes the abnormal gaits that I have sometimes. And I noticed that for me, there seems to be like somewhat of a consistency of having muscle weakness in the mornings, especially like during the summer. I seem to notice the muscle weakness a lot more during the summer months, and also like when the seasons are changing, the weather is a really big trigger for me. But I'll notice like in the mornings sometimes as well that like it'll be really difficult to like open my eyes, and it'll be really difficult to grip things. Those two symptoms in particular I've experienced since like probably around teenage years is the earliest I can remember. But there's other times when I have felt like my legs are really heavy, Like when I did sports in school, like I just couldn't, like my coaches would try, when I was running cross country, my coaches would try to teach me how to like lift my knees higher when I was running so that I could like, I guess like increase my gait stride so that like I would be faster, or at least going a farther distance. And I'm already a short person. I'm like 5'1.5" So I was not the fastest person on the cross country team, but I enjoyed it. But it just like even when I tried to have my legs pulling higher, like that was really difficult for me. I even experienced that like when I was in ballet, like it was just always difficult for me to like when we were doing like gosh, I can't remember the names anymore. I think it's like an arabesque where you bring your leg to the front, side, and back. I like just always had a difficult time like having my legs go as high as other people, which is kind of ironic now because I was like the least flexible person probably in my ballet class, but I have like really subtle joint hypermobility, like things that I didn't even know I could do, like that. I don't know if you can see that. Yeah. And like being able to sit like this, like my hands backwards and stuff, just like weird. I have very subtle joint hypermobility, but anyways, that's kind of off topic. But anyways, there's just been kind of like weird things that I've experienced like with my muscles that I just always thought were normal, like having difficulty opening my eyes in the morning because of the ptosis, having difficulty gripping. I just always thought that was like how my body woke up. I thought that was like everybody was like that. And as far as like my legs getting heavy, like when I was running, like seemed pretty normal to me. Like you're exercising, like that's gonna happen, right? Excuse me. I also had like really severe muscle cramps when I would do sports. Sometimes I'll still get them, like really bad Charlie horses. I literally, like the first really bad Charlie horse I ever got, I remember I was on the swim team and I think the water just happened to be cooler that day. That seems to be a big trigger for me, cold water in the pool, like that'll get me cramped up faster than anything. But the pain was so bad, I thought I literally broken my leg. I was crying. It was really embarrassing. And they were like, oh, it's just a muscle cramp. And I'm like, oh my God, like I thought I was dying. So I like would experience those muscle cramps a lot at night as well. And it was like, I would try everything I could to avoid feeling that way again. Like I would make sure that I was staying hydrated. I would make sure I was eating like 2 bananas a day to try to like anything to prevent that from happening again. So yeah, so there's just been kind of like these weird things. Let me look at my notes to see if I left anything out. Oh yeah, so like during some of these attacks, like I'll have trouble moving my eyes back and forth. Like they just won't have the full range of motion. It's just like difficult to move them back and forth. Sometimes it feels like the corners of my eyes are like pulling down. Like, I don't really know how else to explain that. And then, oh, yeah, this is important. Like, so I'll also get like these cramps like in my rib cage area. Like it feels like kind of like muscle crampy, but then like I'll also like, if it gets severe enough, I'll have trouble breathing, which is kind of what led me into finding out about periodic paralysis. And I'll get into more detail in that in a minute. Some of the other things I've experienced with these attacks, I'll get very sensitive to sensory input, like very sensitive to sound, especially I'll have like crazy mood changes. Like I'll get really, really irritable all of a sudden, or anxious or like weepy, like especially weepy for like no reason. And kind of lost my train of thought there. And Another thing I've experienced is I'll get very drowsy, like super drowsy, like cannot stay awake. And that's really challenging, like when I'm doing like work things or things that I really need to have done, but I'll just have to like take a break. And like, I would say that these attacks usually last like anywhere between like 15 minutes and like an hour and a half. I started to get really concerned about the breathing issues. I had like pulmonary function testing done. One time during an episode, I was at the emergency room, and this was an episode where I was having like difficulty walking. Like it was just like really unnatural feeling to walk, and like I was having trouble breathing, I was having trouble speaking, and they ran blood gas volumes, and they said that like the blood work made it look like I was hyperventilating, but I wasn't like at all. So it was just really strange. And so, oh yeah. So also, bowel and bladder issues, more so like, I haven't really figured out if this is migraine related, because sometimes my migraines seem to be triggered by similar things, like especially weather. My migraines are triggered by weather too, and so it's kind of hard to distinguish which symptoms are which. But I notice that if I'm having an attack of muscle weakness, I tend to get really constipated for like a day or two, and then like I'll also have like slower peeing or like hesitant peeing. So that's something that happens as well. One time, like in the middle of the night, I don't know if this is related, but I was woken up by having really painful hiccups, which was really strange. They were like painful hiccups. I'd never experienced like painful hiccups like that. But I went and I like ate some grapes, and that like seemed to calm it down, and then I went to sleep. And so it was very strange. Something else that I have noticed is that this goes for me and my sister and one of my parents. We are very sensitive to like sugar, to caffeine, and to, what was the other thing I'm missing? I'm forgetting something. That's okay, I'll talk about these. But like, my sister and I will only drink decaf coffee. And the parent that experiences this will have like PVCs, like if they drink coffee, and we all will feel like very ill if we have like high carb, high sugar foods. Like for the normal person, yeah, the normal person crashes, but like this is like not feeling well, like severe crash, like it's kind of hard to explain. But the parent that experiences this was diagnosed with hyperglycemia as a kid, and insulin dependent as an adult. So I don't know if that's like a factor as well, but those are all just like things, right, like that I have in mind. I've noticed that if I have like high sodium or high sugar for like a meal, then either after that or like the next day especially, I'll be having an attack of weakness. Like I said, the weather is a big trigger for me. Alcohol is a big trigger, and I'm not a big drinker. Like I'm a lightweight. I can have like one glass of alcohol and that I'm good. But like I can be very sensitive. It's not always, but like I can be very sensitive to alcohol. And I know like on my honeymoon, um, I had had one glass of wine with dinner one night, and we had had ramen or pho. We had pho like for lunch, and that was a bunch of pasta and I'm sure like a ton of sodium. And then I had like crab cakes that night for dinner and a glass of wine. And I wasn't drunk, but I looked like I was drunk potentially because like I was having muscle weakness and it was hard for me to walk. And so my husband had to drive us back to the hotel. Um, so yeah, it's been a wild ride, but another thing I noticed, I don't know if this is like this, that maybe this is normal. I don't know. I've heard in the support group that it's not normal. It's hard for me to tell what's normal anymore, but um, I will get like burning in my calves, like going up the stairs. I know that's normal, but like I live in a multi-floor complex and I use the stairs pretty regularly. I'm not super out of shape. I work out. Um, I try to maintain my fitness because that really affects my health and my symptoms. And I can tell you that it doesn't really seem to make a difference, the level of shape that I'm in, but my legs always are burning like that second flight of stairs. And it's like I'm told that that's not normal from these support groups, but like I can get that kind of burning sensation in my arms. I think I don't use my arm muscles as much, so I don't notice that as much, but that's just something. Another kind of quirky anecdote is that like as a teenager, I don't know if this is related to the muscle weakness. I think it could be, so that's why I bring it up. But like I broke so many dishes, like I swore that my parents were gonna lose it because like I was constantly dropping dishes in the kitchen, and it never occurred to me that it could be having to do with like difficulty gripping or like muscle weakness. But yeah, I've dropped some dishes in my day. I try to be a lot more careful now. I think that's like the extent of it. Oh, and this is important too. Rest after exercise. I can if I'm actively exercising, then I'm usually good. Like I don't usually experience an attack while working out, but if I'm doing something that's very stop and go, like if I'm doing like really intense repetitions, like with like strength training, and like my intensity is not is not horribly intense because I know not to do that on my joints and my, with hypermobility. But if I'm exerting a good amount of effort and then I'm pausing or stopping to take a break, the weakness will start to set in. If I go for a somewhat intense walk around the neighborhood and then I come back home and I sit and I rest, after a few minutes, the muscle weakness will kick in. So that's when I usually notice it. I have noticed that like sometimes if I am startled by something, like if we're having a fire drill and the fire alarms go off, I'll have like kind of like a momentary weakness then. Licorice tea, I experience it more like not necessarily, I will get weakness, but something I've noticed as I get more heart palpitations from licorice tea. I can also get heart palpitations like when I'm eating like a lot of like refined carbs or sugar. If I have been fasting like for like a medical test, like a blood work or something, I can get weakness like that morning of the fast, and it'll be difficult like walking in to do the test. And if I get like sick or ill, like I had a really intense episode one time and it turned out that like we didn't know what it was, but I had some kind of like transient infection or something, and I was down and out for like a day and a half. Possibly hydrocortisone cream. I have like sweet skin or something. I don't know. I get bit by so many mosquitoes when it's mosquito season. And so I like lathered on hydrocortisone cream one time, and that sent me like into an attack. So, yeah, something I've noticed that helps, there's been a few things that have helped. Eating high potassium foods, and I say that, okay, so sorry, one of the triggers also that I have is like being premenstrual. So like right before my menstrual cycle, I have worse attacks. So I've noticed that before my period, if I'm feeling like I'm going into attacks, if I have something actually that's high carb, it actually can help, which is not usually the case. Usually it seems to be the opposite for me, like high carb. And by that, I mean like refined carbs, not complex carbs, because I usually am consuming complex carbs because refined carbs I feel crappy with. So I've noticed that drinking V8, like low sodium V8 and coconut water help. I tend to get a lot of sensory overload, and I had like a small can of the low sodium V8 and a glass of coconut water before I went to a church service one time. And I had like no sensory overload, and that was like the first time in years. So that was like really encouraging to me. So that really helped with the sensory overload, V8 and coconut water, but it was low sodium V8. I've worn a cooling vest before. That's really helped like in the summers when I am more prone to attacks. The coolness seems to help. Like I've noticed that like if I can have like an attack, like if I'm in my car, I'm in the AC, I'm good, but then I'll get out of my car, I'm in Florida, heat and humidity, I start to literally feel like an ice cream cone like melting to the ground as I'm walking into the grocery store. And then once I get into the AC, if I like can make it to like the freezer section or like where there's like a lot of refrigerated area, I'll start to feel better. And then sometimes oddly, it's like the opposite. Like if I go from like if it's cooler outside and then I go into a warm environment, I'll start to have symptoms like muscle weakness and whatnot. So I don't know, changing temperatures are usually a trigger for me. But yeah, I've noticed that eating like high potassium foods and just eating like lean proteins, fats, like balancing my meals with like lean protein, healthy fats, and complex carbs usually prevents me from having an attack. Like if I eat a banana by itself, that can send me into an attack. If I eat a white potato by itself, that can send me into an attack and can actually trigger like anxiety for me. Like, that's a story I'll share for another day. But if my muscles are cramping, that's just kind of like a general thing. I think it helps most people is warming up those muscles. Like if I went into cold pool water, usually warming up and stretching the muscle helps for those. So anyways, the way that I learned about periodic paralysis was I was concerned about the breathing issues I was having. I had a day where I had gotten in the shower and I started having trouble breathing. And then the next day when I started to go to work, I was working from home and I started to experience the same like difficulty breathing again. I was like, well, it's not usually this, like it's not usually happening this frequently. Maybe I should go have it like checked out. I had read that like Ehlers Danlos patients seem to have like a high incidence of like asthma, and I was like, well, I'd never been diagnosed with asthma, but maybe that maybe that's it. I don't know. And so I went to the ER, and they actually did prescribe asthma medication. So they gave me Advair as a preventative and albuterol as a abortive. And so at that time, I was newly diagnosed with migraine. Also, kind of had hemiplegic migraine in the back of my brain, not literally, no pun intended. But as a possible cause for my muscle weakness, I had joined a hemiplegic migraine support group to see if maybe the stories and symptoms of those diagnosed with hemiplegic migraine resonated with me. And I had also been prescribed Topamax for my migraines at that time, because we were looking into whether I might be having seizures, and I had really bad side effects to Topamax. And so I was weaning off of that, and I was starting this asthma medication. I think this was either in November or December. I can't remember which year, but it was at the end of the year. So when all of the fun, holidays are happening with all the great meals. So I'm weaning off the Topamax, and I was trying out the asthma medication. It didn't really seem to be helping so much with the breathing issues, but it was like the breathing issues came on with the muscle weakness, which was really hard to predict. So it just seemed kind of like it was hard to tell if it was really helping or not. And so I got to, I think, close to 3 weeks into using the asthma medication. So I'm using the Advair daily, and I'm using the albuterol just as needed. And I went to go use the Advair one night just as the regular preventative dose, and started to have more difficulty breathing. And so I was like, okay, so I had read in the little, excerpt, the little prescription manual paper, that you can experience, I think it's paradoxical bronchospasm, which causes you to have, ironically, increased difficulty breathing from asthma medication. So the guide tells you that if that happens, to use the albuterol, and that should reverse it. So I went and I used the albuterol. That made it much worse. I was in a full-out attack of muscle weakness. I was having increased difficulty breathing. I was hunched over my bathroom counter, couldn't talk, couldn't walk, was having difficulty breathing. And yeah, it was really scary. And so that attack actually took me a couple of weeks to recover from. And because it took so long to recover from, I went to the ER. Before I went to the ER though, I just was okay, this does not seem normal to have that kind of a reaction to asthma medication. I'm maybe this is an Ehlers Danlos thing that I didn't know about. And so I started doing research on whether Ehlers Danlos patients could be sensitive to asthma medication, or if asthma medication could cause muscle weakness. And in that research, I learned about periodic paralysis. I'd never heard of it before. But evidently, if you have hypokalemic periodic paralysis, or Anderson-Tawil syndrome, and maybe thyrotoxic periodic paralysis, I'm not sure, don't quote me on that, then an asthma inhaler can cause you to have muscle weakness, because it causes a shift in the potassium levels, and I think other electrolytes as well. And so I was well, that's really interesting. I also did a little more research on Topamax and found that can also affect your electrolytes. And so in my brain at that point, I was thinking, okay, so I have been weaning off the Topamax. I'd been taking that for, I think, like a month. And then I'm taking this other medication now, which can also shift electrolytes. So maybe that's what's causing the weakness. And so I decided to go to the ER, had learned about periodic paralysis, ran it by the doctor there, and he was pretty much like, you know, like, it's probably not periodic paralysis. This happens even to like medical students. He's like, it's not, he was being nice about it, but I was not, I didn't like, so I'll get into this into a minute, but he was using the basis of his thinking being that my potassium levels were normal, which they were in the normal range, 3.8. But in my history of symptoms and everything, 3.8, I'm having symptoms if I'm at 3.8 for a potassium level. My good range is usually like 4.0 to, I'd say like 4.7, roundabout 4.5, 4.7. If I'm like above that or below that, I'm almost guaranteed having symptoms of muscle weakness or like related symptoms that I experienced with the muscle weakness. So I was taking what he said with a grain of salt, and knowing that a lot of doctors have a misunderstanding of periodic paralysis. And so I was grateful that they had tested my potassium. I had specifically asked that. And he said basically like, it's normal for somebody who's doing a lot of research to think that they have a certain condition. Like medical students even experience that. And I was just like, okay, but like my symptoms actually seem to match this diagnosis. But I knew he wasn't a specialist, and I didn't think I could get far that way. So I left that was where I let that lie and I moved on and did recover from the weakness after some time. It took several days after that. And I've continued to have these attacks. Thankfully, not as severely. I seem to be doing better now with kind of like an awareness of what my triggers are, and like just being able to expect them, especially with like with weather changes. Like it's not so new to me that like I'm like freaking out when it happens, which helps. Like it's become somewhat normal, which is weird to say, but like it doesn't rattle me as much. And the only things that I really look out for is if I'm feeling lightheaded and having heart palpitations, or like if I'm having severe trouble breathing, or if I need some kind of assistance because I'm having trouble walking, or I'm having trouble lifting things, or I can't grip things. So I've learned to manage in that way. So the reason that I bring this up is because so many patients in our periodic paralysis support groups have Ehlers Danlos syndrome, have POTS, or have mast cell activation syndrome, or have all of those. And so, like I said, the researchers believe that there could be a connection between them. There's an open question, is the way that I have heard it put, that there could be a connection between joint hypermobility and periodic paralysis. And, when I went to pursue a diagnosis of periodic paralysis, I sought out a local neuromuscular specialist from a very esteemed hospital. Had very high hopes because he was kind of the gatekeeper on being able to get into the MDA clinic. The MDA clinic does see periodic paralysis patients and can help them with treatment, and has kind of like everything all in one place. To me, it sounds like the Disney World for patients. Like you have all of your specialists in one place. So I was like, that's what I need. I need like a holistic approach. I need like a cardiologist and a neurologist. I need all these people in one place. That would be fantastic. To kind of like evaluate my symptoms, because I felt like I was getting like so many piecemeal interactions with healthcare professionals. It's very difficult. So when I went to go see this neuromuscular specialist, and I just want to say, like, this guy was fantastic. He was very kind. Took a lot of time. He took an hour and a half to sit with me, to listen to my symptoms, to evaluate, and to explain things to me. I ended up with a functional neurological disorder diagnosis, and my understanding is the basis of that diagnosis was based on negative genetic testing from Invitae, because of a normal EMG test and because of a positive genuflective gait. Now, I have a lot of concerns about that, the basis for that diagnosis. The first being that I'll just reiterate that normal potassium levels cannot rule out periodic paralysis. And my understanding of that is that you can have periodic paralysis, actually be genetically diagnosed, and your potassium levels will still be in the normal range. And the reason that is because it doesn't have to do with the potassium levels so much as the potassium is shifting into an improper area. So people with periodic paralysis can have symptoms when the potassium is shifting, but it's not necessarily going to show up on in blood work. The other thing is, if you don't know this, this can be a shocker. This was a shocker for me. Using a tourniquet and fist clenching when having blood drawn can actually cause falsely high potassium levels, if that's what you're looking at. And I think there has been one time ever in my life that I have ever had somebody not use a tourniquet and not do fist clenching. So I can have very difficult veins. It's tricky for people. They're small, they're hard to see, they're hard to find, and they roll. So people always use a tourniquet and tell me to clench my fist. And so I often wonder, like, if the potassium levels that I have seen in my medical records are falsely high. Other things that can affect that are how long the blood sample is sitting out. And in Florida, we have very warm weather. My understanding is that if they are exposed to warm weather for too long, then are warmer conditions than are warmer conditions than are required for that sample. I don't know how to put that. That can falsely elevate potassium levels as well. So those are kind of the thoughts going on in my brain. Something I did, and this is not necessarily something I would recommend if you think that you might have periodic paralysis. It has been beneficial for some people who have periodic paralysis. I bought a Horiba potassium meter, which requires calibration every time you use it for it to be accurate. And I learned this the hard way because I went to my general practitioner and asked her if I could test it against serum potassium levels to see how accurate it was. And it was off, but I had not calibrated it just before either. So, and this product is not made for testing in periodic paralysis. So that opens up a can of worms in and of itself. The reason that I got it was because I wanted to get like a baseline idea of my potassium levels and to see if I could recognize any kind of patterns happening when I was symptomatic. And I did. I've noticed that when I'm symptomatic, my potassium actually goes pretty high, and I've caught it outside the normal range, especially when I was consistently eating refined carbohydrates and more sugary foods intentionally to provoke attacks, which it did. And I've noticed that in the hospital setting, when I've had my potassium levels tested and I'm symptomatic, I tend on the low side, on the 3.8 side. And I think I've even had as low as 3.4 and as high as 5.4 in the hospital setting. But that's a whole other crazy dynamic that you can read about. I'll put a link to the Pursuing a Diagnosis guide if you are interested in learning about how to pursue a diagnosis in periodic paralysis, information that can be really helpful. Like when you go to the ER and they're saying, oh, your potassium levels are normal, things to look for there. And like notes that you can print out for the practitioners to kind of re-educate those who might have been misinformed in medical school, or they only had a brief snippet in medical school, So yeah, that's been my periodic paralysis journey and how I got to a functional neurological disorder. The other reasons that I think that the FND diagnosis could be faulty, at least on the basis that I mentioned before, is that something I'm very grateful for is that the neuromuscular specialist that I saw, he admitted even that he didn't have many periodic paralysis patients, so he could be wrong. I asked after the initial consult, which was that hour and a half, I asked if I could have the CMAP test. And when I said CMAP test, he said, do you mean this test? And it was kind of startling to me because it seemed like maybe I misunderstood, but it seemed like he didn't know, wasn't informed about the type of specific EMG testing that is done for periodic paralysis. My understanding of that is that it needs to be extremely accurate. It can be fairly specific to periodic paralysis. It can be very helpful in the diagnostic process. If you do have a positive CMAP or long exercise test, it needs to follow the Fournier protocol. And I learned this from Dr. Jacob Levitt, who himself he's an MD that happens to have periodic paralysis, and he has, I think, hypokalemic that's pretty severe. He's recorded some YouTube videos about it. But when I went to have this EMG test done, the tech, who was also very sweet, she told me, she was very transparent, which again, I really appreciate. That's very helpful to me as a patient. But she said that they were using a cheat sheet because this test was so rarely performed, which is understandable. It's a very rare condition. It's very understandable that that practitioners don't know about this condition because it's considered so rare. And so she said they were using the cheat sheet, and when I asked if it was the same as the CMAP or the long exercise test, she said that they just called it the periodic paralysis test because it's the only test that they do for periodic paralysis. And it's the only time they ever use it. But when I compared, remembering in my experience, the methodology that she took, and I'm not an expert, I'm not a doctor in any capacity, so please take everything I'm saying here with a grain of salt, do your own research, ask the questions that you need to ask, be critical of what I'm saying, because I have blind spots as well. But based on my experience and what was in the test notes that I could pull up in my portal, it didn't seem to match the Fournier testing protocol. And there's all kinds of specific parameters that have to be followed, like the specific temperature that the room needs to be, the placement of the electrodes, like which sides of the body are used, all that good stuff. So I have doubts as a patient. I have doubts about whether the correct test was performed and whether it was accurately performed. And especially if like the diagnosis of FND is being based slightly on that, which in my understanding, the FND diagnosis needs to be made based on positive test results. So, or I'm sorry, not positive test results, positive signs. So those are big things looming in my mind. There was also, I think, additional context. I think that this neuromuscular specialist that I saw is very well versed in FND. But when I brought up things that are a concern in periodic paralysis, so for example, the parent that I have that also experiences the sensitivity to caffeine and to sugar and that kind of thing, also experienced dilated cardiomyopathy. He went into cardiac arrest and had a stroke, and now has an internal defibrillator. Prior to that event, he had PVCs, periventricular tachycardia. Am I saying that right? I'm just going to stick with PVCs because I know that's right. He had arrhythmias for a long time prior to that, and started passing out. Like, he would be running and working out, and then he would stop and he would black out and he'd pass out. And so that was something that I watched a lecture by Dr. Tawil. He's one of the physicians responsible for research on Anderson-Tawil syndrome, which is a type of periodic paralysis. And he basically described verbatim what my parent experienced as far as heart issues go. And the interesting thing to me is that Steve Cannon, who's also one of the other experts in periodic paralysis, has said that even within the same family, if there is periodic paralysis or Anderson-Tawil syndrome, like one patient might have the muscle weakness while the other patient or the other family member has the arrhythmias or the heart complications related to it. So it's not necessarily presenting the same way, even in the same family, which seems to be like consistent with how things are going in my family. I do have other family members that have experienced muscle weakness. I have a cousin that has had difficulty going upstairs and difficulty standing from a seat, and also weakness in her hands. And I have other family members, cousins, and like their kids who have had like heart palpitations and like weird things like heart palpitations like in response to like loud noises. So those are kind of like on my mind as why I think that I could have periodic paralysis. I specifically think that I could have Anderson-Tawil syndrome. I think that our family does have some of the physical features of it. The parent that I was speaking about has a recessed chin. I think my sister and I have similar like small chins. I was diagnosed with an overbite, and my sister and I both have like teeth crowding, which we both had braces. We both had teeth removed because of the overcrowding. I don't think we have low set ears. I don't know the measurements on that. But My sister and I are both pretty short. I am 5'1.5" and my sister is 5'2.5". I have curved pinky toes. I have a slightly, I don't know if you can see this, slightly bent pinkies, very, very slight. I think those are the biggies. But yeah, so I'm sorry, I didn't really explain that very well. Those are the physical traits that can be seen in Anderson-Tawil syndrome. There's also, I've read in the literature, an incidence of scoliosis in Anderson-Tawil syndrome, which both of my parents had scoliosis. My mom had severe scoliosis, like she had to have surgery and everything for it. So yeah, so I think there's, for me, like I still think there's possibility that I do have periodic paralysis. Do I think that I don't have FND? I don't know. I go back and forth on this, to be honest. I think I don't know enough. I think we don't know enough in general, like in the science, for me to definitively say one or the other. I've had complex tics, which I think is something that can present in FND. But I've also seen that in other conditions. So I don't know. I'm going to do the best that I can to manage and treat what I can. I did go to physical therapy to see if that would help with the muscle weakness. It actually triggered the muscle weakness for me. Like I'd be fine during the PT sessions, but then afterward, when I got in my car, I would experience weakness. But it did help with my posture. I know it's not really showing tonight because I'm hunching over a lot, but this has been me like my whole life, like, right? Like this. And like, honestly, I feel like a whole new person from the muscle strength that I have gained in my back and in like my upper body. And I'm like, just being able to maintain posture. Like I used to get told when I was a kid, like, sit up straight. You're going to get a hunch in your back. You're going to get like a bump in your neck and all this. And it always just felt super exhausting, but little did I know, like training the muscles, man, that really helps. So that's just a little side note, but I have heard from other experts in FND that strength training in PT is not very effective for functional neurological disorder. So I guess I shouldn't be too surprised that it didn't help the muscle weakness if it's related to FND. But when I spoke to the physical therapist that I was seeing, and I told her, hey, like this has been amazing for my posture and my muscle strength in general. But I'm still experiencing these attacks after I go to sit down after these sessions. And she said she had no idea, but she said maybe it was electrolyte related. And that would, to me, that seems to fall in the periodic paralysis realm with potassium being an electrolyte. So yeah, I know that was a lot to unpack. That was a lot of information. I'm thinking about splitting this up into 2 different videos. Yeah, I think I'm going to do that. So I'll end it here for this one. Thanks for listening. That is kind of just the background on how I came to learn about periodic paralysis, how I came to an FND diagnosis. I am going to see a specialist who specializes in periodic paralysis specifically in the coming months. And so I hope to gather some more insight from her and get her thoughts on whether Anderson-Tawil syndrome or another periodic paralysis might be what I'm experiencing with these attacks of muscle weakness. So yes, I'm going to put some resources in the description below, and then I'm going to carry on in another video so that we have a little break here. All right, thanks, and I will see you soon. Bye.